So here's how our free consultations work. Anybody who hasn't been a patient can register for or sign up or schedule a free consultation. And we tell them we're going to schedule full appointment time. So if you want to stay for a full appointment, you can stay for the full appointment. The consultation is the first 15 minutes. So I'm going to let you tell me what's going on. I'm going to tell you what I think's going on. I'm going to actually show you what I would do with you if you were a patient of ours. I'm going to walk you through why the stuff that you're doing did previously at your chiropractor, your physical therapist, whatever you did at home with the information you got off the internet, none of that stuff worked. I'm going to explain why that happened. And if you want to stay for the full visit, we already have enough time for a full visit, which is a half an hour time slot. And I will finish the whole visit. I will give you your home program. I will do everything like a normal visit, and you will pay for that visit. So 99.9% of the people that I've done free consultations with for the last 18 years have stayed for the full appointment. Why? Because when you explain to them what is going on, when you explain to them using fact what they've been doing and why that hasn't worked, and you demonstrate what you can do that nobody else can do, they say, oh, that actually makes sense. I can actually feel the difference in my strength. I can see the difference in my balance, my range of motion, all of that stuff, and my pain is gone. And the majority of the time, I never touch the painful area. So if they're coming in for low back pain, 99% of the time, I'm never going to touch their low back. So when I'm screwing around with their knees and their feet and their shoulder and they're going, yeah, but it's my back that hurts, and I'll say, just 1 second. So halfway through, so at the end of the 15 minutes, what I do is I get them up and I do the screen. So let me lay out what happens. So they come in, give me their subjective real quick, 1 minute. I run them through a screen, 1 minute. I put them on the table and say, okay, remember what that felt like when you did that on the screen, your toe touch, your range of motion with your shoulder, your squat, whatever their problem was. Go through and treat one side of their body, whether it's upper or lower extremity, then get them off the table and redo the screen and say, okay, now what's that feel like compared to what it felt like before, and compare it to the other side that we haven't worked on yet. And 99.9% of the time, they'll say, yep, I want to stay for the whole visit. So I'm not giving anything away. I'm not discounting anything. They're paying full price for a regular visit. I'm not, at the end of the visit, I'm not trying to sell them a package. If you're selling people packages, what you're telling them is you can't get them any better than what they are now in this amount of time, so you want to sell them a package to keep them coming in to put money in your pocket. So once again, you're giving yourself value by devaluing your patient. So I don't do packages. If they want to sign, if they are a cash pay patient and they want to do a punch card, they can do a punch card. I'll do another video on punch cards and how we do that and how that works, so they can actually use that for their family, how often they renew, all that kind of stuff. But I don't sell them a package and say, okay, here's what I'm going to give you. You can use, you can use our equipment over here, and I'll give you a discount on this, and you have to come in twice a week for 6 weeks. No. Here's what I'm going to do. I'm going to fix your problem. I'm probably going to see it twice the first week. I might see it once or twice the second week. Third week might take off, might see it once a month. So we go from seeing you frequently to not seeing you that much, because I'm going to give you more things to do at home. Your symptoms are going to go down, your range of motion, strength, everything else is going to go up. So why do you need to come in here twice a week? If you're telling people they need to see you twice a week for 6 weeks, you're telling them that you're not going to make them any better for 6 weeks. Something like 75 or 80% of idiopathic low back pain will go away in 6 weeks with zero treatment. So if you are taking 6 weeks to get a low back pain patient to feel better, you are doing the wrong stuff. Low back pain patients should be better in a half an hour, not 6 weeks. And then they should be coming in twice a week to once a week to every other week to whatever. So that's how we do the free consultation. That's how it turns into a normal visit. That's how that patient turns into a normal patient. There's no sales gimmicks. There's no upsells. There's no packages. There's no pressure. If you don't want to stay after the 15 minutes, leave. I've had people that I've seen after 15 minutes and say, I think I've fixed everything in 15 minutes. You really don't have that much of a problem. I'm just going to let you go. If it flares back up, just let me know. How many people are thrilled when you tell them, I'm going to see you for free, I'm going to fix your problem in 15 minutes, you don't have to come back? How many people do you think that person tells about me and says, hey, this guy saw me for free, fixed the problem that I've been having for 6 months in 15 minutes. You should sign up to go to see this guy for a free consultation. That's it. No sales, no gimmicks, no junk, just results and value for your patients.